Hi, my name is Eleanor Zacharia, and this is my project on surgical site infection prevention. The purpose of this project was to determine an intervention that would prevent and reduce the number of surgical site infections within the hospital. Through research and evaluation of evidence-based practice, my goal was to provide an intervention to prevent surgical site infections for patients who are admitted to the hospital and undergoing surgical procedures. This is important because surgical site infections are one of the leading causes of hospital readmission. My project represents leadership at the bedside because I have transformed care using leadership qualities in collaboration with members of the healthcare team to produce positive patient outcomes. To begin this project, I started with proposing the assignment to my unit manager. His contribution was being the driving force for change in my hospital and assisting me with creating a policy to implement change. The infectious disease coordinator was an essential member of my team because she provided me with the data I needed to evaluate the progress of the new policy. The rest of the team was comprised of the nursing staff because they were the main components that I relied on to carry out the new policy. The nursing staff, in addition to this contribution, also provided feedback and improvements that could be made to ensure this process was smooth and yielded the intended results. Without these members of the team and their mentioned contributions, I do not believe my project would have been a success. The specific aim of my project was surgical site infection reduction. The aim statement was, we will reduce the percentage of surgical site infections on the surgical patient unit, the 6th floor, at Mercy Hospital of Buffalo from 60% to 40% by May of 2019 by implementation of preoperative showers and HCG baths. Working on a surgical unit and through research, I was able to determine the project aim and what my goals for transformation of patient care would be for this project. According to Eliquis Healthcare, surgical site infections cost the healthcare system an estimated $3.5 to $10 billion yearly, making it an important costly issue in the realm of hospital-acquired infections. It has also been found that up to 60% of surgical site infections are preventable. After learning these statistics, I had decided the change that needed to be implemented would be in the nursing care that is delivered to patients in the preoperative hours. This included the introduction of pre-op showering and CHG bath for all patients scheduled for the operating room the next day. The steps of the PDSA cycle are as follows. Plan. I began the process of formulating my change project by extensive planning of the aim statement, the team members I would recruit for assistance, and the way I would present the project initially to those team members and the staff at my practicum site. At the do step of the cycle, I began putting the plans I formulated into motion by formulating and solidifying the aim statement. I then recruited the team members by having them sign the form that was required for submission. I simultaneously presented my aim statement to these members as I was recruiting, ending with presenting the project to the nursing staff at my practicum site. When I reached the study step of the PDSA cycle, I was collecting data from the infectious disease coordinator, and together we analyzed the data to determine if we were meeting my intended aim for the project. This took place on a weekly basis. I also utilized the study step of the cycle when evaluating changes that needed to be made to improve the implementation of the interventions. I was able to determine this through nursing staff surveying. Lastly, my approach to the ACT step of the cycle was based on the previous step, study. When collecting the survey results from the nursing staff, I then acted upon those results by collaborating with the other members of the team, an interdisciplinary healthcare team, to implement changes to improve the process of reaching the aim statement. To begin the implementation of change, I started with research to determine the reason for why I wanted to implement this project. I learned just how detrimental SSIs, or surgical site infections, are to patients and the healthcare system. Once I determined this, I spent a lot of time with my unit manager researching evidence-based practice from the CDC and more on possible interventions to reduce the SSI rates of surgical patients. What we found out was the best way to prevent surgical site infections is through preoperative showering the night before a scheduled procedure with CHG solution and the morning of. The first barrier I encountered with this proposed intervention was getting the approval of the board members at the quality and safety meeting. To ensure my approval, my manager and I decided to design a policy that we could present at a meeting to gain their support. We had to determine the patient population, the current data for our hospital on the 6th floor, the surgical unit, the supplies needed, and how we would educate our staff on the new policy. Once we drafted and determined this information, we were able to present it at a quality and safety meeting and gain support of the infectious disease team, the CEO, and director of patient care. This allowed us to move forward with the new policy and create a finalized version. The policy stated that patients scheduled to go to the operating room are to have a preoperative shower, including hair washing, with CHG soap at 9 p.m. The following morning at 5 a.m., the patient should have another shower using the CHG wash. This is where I ran into my second barrier, which was determining how I would ensure supplies were adequate and how we would use our budget to maintain the stock of CHG products. I was able to overcome this barrier by meeting with the Director of Environmental Services, who helped us order the proper supplies within our unit budget. Based on the AIM statement, I intended to reduce the rate of surgical site infections on the 6th floor from 60% to 40% by the month of May. I plan to achieve this goal by implementing evidence-based practice, which was found through research to be preoperative showers for surgical patients. My anticipated goal became a reality when the project took off and data collection began. Data collection began starting March 1st when the project was implemented through the help of the infectious disease coordinator. Each week, she would pull up the admissions to the hospital each day to determine the admitting diagnosis. Through this method, we were able to collect data regarding readmission to the hospital and screen for surgical site infection admissions. Another way we collected data is from my unit manager. He was required to keep track of reports of surgical site infections on our floor daily. To my surprise, through the month of March leading up to the end of April, we had a 0% surgical site infection rate since implementation of the project. This project has been a rewarding experience and has allowed me to take on a leadership role to transform patient care at the bedside. I have included visual representation of the results from the months prior to implementation in 2019 and the results after implementation starting in March. I have also included a photo of the policy we created that is posted on the 6th floor for staff education. This concludes my surgical site infection prevention project. Thank you for listening.